Option 2 is Medicare Advantage. These are the private insurance companies that are contracting annually with Medicare to provide the benefits to you. You are still paying your Part B premium, but Medicare is not who is providing your coverage. The Medicare Advantage plans have to provide the same types of services as Medicare, but they do it in a different way. I compare these plans to group insurance. You've got co-payments for almost all of your services. Co-payment for a doctor visit, co-payment for lab work, co-payment per day in the hospital, co-payment for your surgery. All of those co-payments add up to an annual out-of-pocket maximum. Could be $5,000 to $10,000 depending on if it's in or out of network. Now these plans have very low premiums. You could have a $0 plan, $30, $50. The reason they can do that is because Medicare is giving them money in advance. They are paying the company to provide the benefits to you. You are subcontracted out to them. So they have low premiums because they've got their money up front. But then you are paying as you go. Pay now or pay later. It's all about risk assessment. It's insurance. You're going to pay one way or another. Now these plans can often include drug coverage. So you're still going to pay co-payments for your prescriptions. But your co-payments for your prescriptions do not apply toward that medical annual limit. They are two separate sections within the same plan. So in the Medicare Advantage plan, you still have initial coverage, you still have the donut hole, you still have the catastrophic coverage. Those phases still apply within this Medicare Advantage plan. But these are network-based plans. You've got a pretty large area here, so my guess is your network strength is pretty strong. But you still need to be aware that if you are in an HMO and you go out of network, you do not have coverage. PPOs do have in and out of network coverage. So Medicare Advantage is network restricted. Medicare, traditional Medicare is nationwide. Now the Medicare Advantage plans could have reciprocal or sister networks. If you are traveling, let's say you're going to Florida and you know you're going to be there for a couple of months. You can call your company and say, I'm going to be in Naples, Florida for a month. Where do I go if I get a cold? They can make a note that you are now in network in Naples, and they can tell you who to go to. If it's an emergency, it is always in network. Emergency and urgent care are always in network. But if you got a cold, that is not life-threatening.